in the course content. Those will be covered this week. Remember that there are 3 attempts of this assignment. The first and second are just opportunities to receive feedback via the rubric and narrative comments. And the third attempt is a graded attempt. And if at any point you feel that you're not progressing as expected, we invite you to seek additional help and assistance through your course instructor and OAs. So remember to start with an overview of the assigned reading. The assigned reading for this section will prepare you to conduct literature review and establish the significance of your project. Concepts to understand. So we're going to go through a few lecture-based content items here. So the ultimate goal of the DNP project is to utilize evidence-based nursing practice through a quality improvement project. So through a few things that are specific to evidence-based nursing practice. In evidence-based nursing practice, we utilize randomized control trial perspectives. We utilize qualitative and quantitative research, clinician expertise, patients, clinical state, clinical settings and circumstances, patient values, preferences and beliefs, cost effectiveness, and we have an emphasis on quality care. So as you consider evidence-based nursing practice, we'd like you to apply some of these concepts to your DNP project. Remembering that DNP projects are at the system level, so translating this over to DNP project level, we do want to utilize all types of peer-reviewed relevant research to the project topic. We do utilize content expert perspectives in developing the DNP project, and we do consider the perspectives of the organization, the vision and the mission of the organization, and how those things relate ultimately to the DNP project. DNPs play the role of critical appraisal of literature, so you will get to utilize that role here in this section of the DNP project. We do expect that you have come into the program with some foundation of scholarly inquiry from your bachelor's degree, so you should be familiar with how to search computerized bibliographic databases. So we invite you to review the TUN library and its resources. This is an expectation of all DNP students. And also we expect you to be familiar with scholarly search engines and appropriate filters. You have a few resources available to you if you are having a hard time figuring out how to do a scholarly search. We do have a librarian. We have some library resources, library orientation, and I did want to list this website, which is actually also listed in your textbook. I am not even going to try and pronounce it, but you can see the key search terms here are HIRU, Hedges. So Hedges is a project that was started by this McMaster University. I believe that is right. Check the website just to make sure. But Hedges is a project that harnesses appropriate search filters. So it teaches you how to use the right search filters to get the results that you're looking for your scholarly inquiry. So different words can play different factors, and if you go to that website, it'll actually give you the specific search engines and then how to get what you're looking for. So very helpful, and that's just a resource for you that you can use. All right, so search engines. What are some good search engines? I've listed a few here that I will just ask you to review, and you can utilize these. If you want to take a minute and write those down, you can pause the video. And then ones that are maybe less common that I wanted to talk about. These ones are more traditional. These ones are a little bit less common. So UpToDate.com. If you're primarily a clinician, you've probably used this quite a bit. But this resource it's built by physicians and medical providers, but it is a medical decision support resource. So it's actually very good. It is always surprisingly up to date. What can be very useful on there is their reference list as well as the information there. And it does have some, there's a lot of stuff on there that you wouldn't think would be on there. So I'd invite you to try and go to that site. We do have access to that database through TUN Library, and go ahead and look and see if you can find your project topic there, and it'll be a very helpful resource. That site also, while I'm on that topic, does on their reference list, if there's a national guideline available, it will be referenced there. And there's even a tab that on some searches that you can click on to give international and national guidelines, and they will list each of the guidelines. You'll be able to look at them, and the more national guidelines you have to support your project, the better. So the other point that I wanted to make is you want to be aware of what current practice is, not only on a national level, but on a local level at your actual practice site. So utilize the intranet, if they have one, to find out if there's any current policies or procedures being utilized at your site, and please make sure and discuss that in your literature review section. And if they don't have an intranet, they should have a policy procedure book that you can take a look at. So search terms and use of filters. So best way to start a search is to utilize your PICO, PICOT, or PICOT with a double T question. Additional search terms can be used as necessary. You want to make sure that your search terms are returning an appropriate number of results. So definitely less than 100, and you want more than at least, you definitely want 20 to 30 articles to support your DNP project. So be sure that you have enough, but not too many. And that can be affected a lot. Your number of search terms can be affected quite a bit by the filters that you utilize. So again, use the Hedges website. That is listed in the Moran text, and also you can just perform a Google search based on the previous slide I showed you. The word or and can return different things based on very small changes. So you really want to make sure that you're putting things in the right order, that you're using the right descriptors, and that will help you to get the results that you're looking for. Other filters that can be used are English language filters. Last 5 years is preferable. Last 10 years is acceptable in some cases. And historical data can be obtained from even further back from that. Full text available is a really important one, because then you can review the full context of the article, and any other appropriate filters for your project. Okay, literature review. So your textbooks have some really good descriptors on how to conduct a literature review and what a literature review is, what its purpose is. So I really invite you to take a minute, and if you are having a hard time understanding those concepts, please read your textbook. I'll briefly touch on it. So one thing that we really want to make sure you understand is that a literature review is not just a summary of the literature that's out there. We want you to find the relevant information to your project topic and summarize it using themes and sub-themes. The articles that you choose to take into your literature review should be appraised for appropriate level of evidence, applicability to your specific practice setting, practice topic. You should consider all of these things, and when you're looking at a specific article that pertains to your topic, are there multiple articles saying that same thing? So this is part of the appraisal process. All right, you should also utilize your literature review to present data to support the need for the project and support the project intervention. So also think of your ultimate goal for the project. If you are performing or if you're developing a guideline at the project site, every single component of that guideline should be supported through evidence in articles that were presented in your literature review. So make sure that you consider that as well. You should use a systematic method in conducting a literature review. So your textbook actually gives two different examples of a systematic method. I like both examples, and I utilize both examples when performing my own literature searches. So the first example they gave was to develop a list of relevant materials. So that's essentially conducting a literature search and then taking a list of all the different articles and organizing them into topics and making sure that you address all of them. So that's a really good idea. You can create an outline from that, and then also I would take those articles and look at their reference list. The reference list will lead you to other supporting articles that can further justify the point you're trying to make in presenting those articles, and you can actually go to those original sources and review those articles as well. So looking at the reference list itself can be a form of literature search. That is particularly helpful, I will mention again, on UpToDate.com. So if you look at UpToDate.com and you find, if you go to their reference lists they're very robust. And they, again, always contain national guidelines if there are national guidelines on that topic. So that's a very good method. All right, so next, remember that any findings, and I kind of mentioned this, any findings that you locate in your articles, they should be reproducible. So try to avoid standalone articles that present a new idea but haven't been well established throughout multiple articles. And that would be, if you're not finding multiple articles, then that's not really a theme that you found. That's just a standalone article. So findings should be reproducible. And then again, obtain primary source information whenever possible. So if an article that you found that you like, maybe it supplies a reference to another article, go ahead and follow through and read that article. Find that article, read the original source if you want to cite it in your paper. And that is particularly true of national guidelines. So if you are reading an article and it is referencing a national guideline, please make sure that you do follow through and read that national guideline. Don't use the secondary source of the article to reference the national guideline. That's really important. All right, so consider what resources do you have? Again, the DNP project handbook, the project examples in the text and in the handbook, and then of course your project team. You're not alone. We always want you to know that. All right, so writing the paper, I'm going to give you a few practical tips on how to write your paper. A few things you'd want to pull out the example paper that we provide for you in the course. This is also located in the DNP project manual, but there's a Word document form of it in the actual course that may be more useful. We provide some headings there that are examples of some themes or sub-themes that may emerge. And some of these headings are actually taken from the rubric, so some of them are required, and some of them are just some examples. So you'll need to formulate these ideas on your own. So as you did your literature review, you developed themes and sub-themes that you may be organized into folders. Those folders will then become headings, and you will examine each of those pieces of information in your literature review. All right, so the next step is to pull up the rubric and question, how do I get full points? This rubric is more conceptual based, and so you want to make sure that you're conceptually addressing these things throughout your literature review. So it does require a higher level of synthesis to do this. So you want to utilize, again, your headings and then address those concepts under each of the headings. The best way to do this is to develop an outline using your themes found in the literature, but be sure to cover all the points from the rubric. So this, I'm now going forward into the rubric and I'm going to talk a little bit about each of the different headings. So you want to address the significance of the evidence to the profession. That's a really good way to start out your literature review, to kind of give a little bit of a summary of the significance. So significance can mean prevalence statistics, it can mean incidence statistics, it can mean and it can also and should mean, how is this issue significant to the nursing profession and to nursing leadership? So tie in your topic to maybe national standards, global standards of healthcare, and leadership issues. All right, so review, coverage, and justification. If you look at your the document that gives you some examples of headings, we provided a heading of search terms. That's the first one. So in exploring your search terms, there's a few things you want to do. Tell us exactly what you did. So here I believe it says search methods clearly identified. So clearly identified search methods, that would be telling me exactly which search engines you used, how many results were returned, maybe initially too many results were returned using the initial search terms. So tell me how you changed your search terms to get more appropriate number of search results. You also want to tell me the specific number. I'd like to know the specific number of search results that were returned from each search term. So be very specific in describing your process. And again, if you're confused about how to do this, you're welcome to look at some of our project examples that are on doctorsofnursingpractice.org in the repository. And explore, as, of course, the criteria of inclusion and exclusion of studies in the literature and justify that. And the content of the chosen studies can explicitly link to the project topic. All right, so review synthesis. So at this point, you should have a full outline of everything you plan to cover in your literature review, and that should be based on your previous search and the organization of your ideas into themes and subthemes. So under each of so first you can do kind of a general review synthesis at the beginning, and so it describes that here. The project topic is systematically described in the context of the broader relevant scholarly literature. So you could have like a section at the beginning that says, after your search terms, and you could say review synthesis, and basically give me a brief summary that says, here's everything I found, and here's overall what I found, and here are the themes that emerged, and here's what I plan to explore. And then you're going to break down into your subheadings and subheadings for each theme that emerged from the literature. And then within those themes, you should again do a brief review synthesis. So let's say, as an example, that you have explored diabetic foot ulcers as in your forming a protocol on diabetic foot ulcers. So if that is your project, then I would expect that you would probably develop some sort of theme, and therefore a heading that said something like medical management, and then maybe podiatry consult. So there's probably going to be several articles that emerge from that. So I'm going to suggest that you go after medical management. I would think that you would do a review synthesis on what articles were present on medical management for diabetic foot ulcers. So this says relevant literature related to the historical context of the profession is discussed, best evidence in the profession as it relates to the project topic is distinguished, and need for translation of evidence is justified. Discussion includes what is currently understood, issues still under investigation, and issues that have not been addressed in controversies. So as you develop your themes and subthemes, make sure that within those, that these themes are addressed. So you should at least address those at some point in your literature review. So review study methods, main methods, and techniques in relevant scholarly literature are clearly identified. Relevance of methods and techniques, project topic, and project aims are clearly described. So let's again go to our podiatry consult. So under there, you're going to give me, maybe there's like 10 different articles or 5 different articles that examined the use of podiatry consult in diabetic foot ulcers. So in each of those articles, you're not going to give me an annotated bibliography, but you're going to kind of give me a presentation of those ideas. And in presenting the information, I'd like you to tell me that this was a randomized control trial, this was a qualitative study, whatever it was. Give me the relevance of the methods and the techniques, the project topic and project aims. All right, and then lastly, APA and clarity, those do count. Make sure and review the rubric, and supporting evidence, at least 10 scholarly articles that would be a minimum. Try and shoot for more. All right, so ultimately, good luck, and I hope that this lecture is helpful.